What's that? Good afternoon. Today we're going to walk folks through our state's coronavirus vaccination plan that's due to the CDC today. We're submitting it to the Center for Disease Control. We can adapt it. It is amendable over time, but we want to make sure that people of Colorado understand how Colorado will address vaccine distribution, prioritization. To be clear, there is not yet a vaccine that is safe and effective. Pfizer announced today they hope that they can pursue emergency use authorization in late November. We hope that that is the case, that of the 4 vaccines that Dr. France will talk about that are a part of Operation Warp Speed, the several dozen that are also being independently tested, we are hopeful that the first will be approved for emergency use as soon as late November. And then that does not mean that they are widely available in late November or early December. We are expecting limited supply at first, which is why this plan and prioritization is so important for folks to understand. Really a great team put it together. I want to thank Diana Herrero, the Interim Deputy Director of the Division of Disease Control and Public Health Response. We're also joined by Jill Hunsaker-Ryan, Executive Director of CDPHE, and Dr. Eric France that'll walk you through that process. But of course, first, given that we don't have a safe and effective vaccine today, we will not have one tomorrow or next week. We are very concerned about the number of cases. Today sets another high for Colorado, 1,312 confirmed cases, hospitalizations 352. It continues to increase. This is the most since late May. And I am very concerned about this trend. We had 3 days over 1,000 cases, and our positivity rate continues to be just over 5%, which is really a threshold from the World Health Organization for whether enough testing is being done to limit the spread. So Coloradans, we need to avoid gatherings. Just to put this in perspective, we've come through a lot on this, and you know, we're going to talk about the vaccine and hope and the future, but we've got to get through these next few weeks and months, and we've got to bring this under control. Right now, as we speak, about 1 in every 260 Coloradans are currently contagious with coronavirus. That means that if you go to, 3 gatherings or 4 gatherings of 30, 40 people, you have a 50% chance of encountering somebody who's contagious with the virus. That's just to put that highlight on that. About 1 in every 250 Coloradans are currently contagious, 1 in 260. We really need to avoid these gatherings. Keep it to 5 people or less, 10 people or less. If you have social plans this weekend with some friends to get together at their house or wherever it is, I suggest that you delay those a few weeks. We need to avoid groups and mixing to get this back under control. If you are going to socialize at parks and outside is obviously better than inside, and of course wearing masks can also have an impact. But I really can't emphasize strongly enough how concerning these trends are. We are not currently threatening our hospital capacity, but if you extrapolate the same trend we've seen for the next few weeks, we could be in trouble in a few weeks and next month. So we want to act now. We want to avoid overwhelming our hospitals, over 350 COVID hospitalizations. This is a critical juncture. We need to get this under control now before we head further into holiday season and winter. We want to make sure there's a safe environment in Colorado for families to be able to have Thanksgiving together and honor their holiday traditions and be able to achieve that, to be able to bridge this time period until a vaccine is distributed. We've got to do better at reducing the number of people we see, keeping our distance, and really avoiding gatherings. That's the single biggest cause of this is just people getting together, which people love to do and we all love to do. And we have to do that virtually now to stay safe. We have to change and delay plans, and we have to do better to get this under control. It's not just the health issue, it's saving lives, preventing the overwhelming of our hospitals. It's also our economy. and jobs that rely on consumer confidence and us being safe enough for tourists to want to come here and all of these things. So we need to look deep inside of all of ourselves and say, how badly do I want to stay safe? How much do I value my own life and the lives of my friends and loved ones? And I know that Coloradans do value their own lives, value the lives of their friends, their loved ones. Even if you're 24 and you might only have a 1% chance of being hospitalized, if you come down with this, you have aunts and uncles, you have grandparents, you have friends, you interact with people in different generations at the store, on the streets, and we all need to step up and show that responsibility to do better, to reduce this dangerous trajectory that the deadly virus is on in Colorado, as Coloradans have successfully done twice before. And bridge that gap until a vaccine can be widely distributed. We also have a little, obviously an important wildfire update. As you know, Cameron Peak Fire is now the largest fire in our state, surpassed the Pine Gulch Fire, which also occurred this year. Cameron Peak is at 169,171 acres, 56% contained. So in 2020, our state has experienced our largest and our second largest fires in the history of the state of Colorado. As the firefighters focus on putting out and containing the fire, our Office of Emergency Management is already supporting the county damage assessment process, supporting resource requests for additional fire resources, sources, and sheltering. And the damage assessment is critical because it determines a path forward in cooperation with FEMA, Small Business Administration, for the businesses and individuals that are affected. And the state recovery officer conducted tours with NRCS representatives earlier this week to look at the impact on watersheds. So even as our brave firefighters continue their work to contain the fire, prevent the spread to population centers, the recovery is also being put together with the programs that emergency management will work on with local, state, and federal partners to help the community bounce back. So as I mentioned at the beginning, there's a lot of discussion about a COVID vaccine. Earlier this week, we saw news alerts about how Johnson & Johnson and then a day later, Eli Lilly both temporarily paused their COVID-19 clinical trials due to safety concerns. That's not unusual, but it is an indication that the safety systems are being taken seriously as they should be, that they're working. Also highlights the uncertainty around the timing of a vaccine. The other announcement from this morning was Pfizer announced that emergency use might be available as soon as the third week in November. All of that depends on their data set that has to include all of October. So the data set will be through October 31st. And if the data set is positive, the emergency authorization might occur as soon as the third week in November. Now, the unknown part is once that is granted, there's several unknown parts, obviously. One is this a vaccine that in the trials that are written up through October 31st, is it 50% effective? Is it 70% effective? Is it 90% effective? Makes a big difference. And then the second piece is how many Colorado gets and when. And we're going to be talking about how we prioritize. But, if we get 1,000 vaccines in December, that doesn't make much of a difference at all on the trajectory of the virus. So it's about efficacy, and it's about quantity and the date of when those will be available, particularly from those 4 vaccine trials that Dr. France will discuss in particular that are on an accelerated basis to seek emergency authorizations as soon as late November. Again, the world doesn't transform overnight when there's a vaccine that works because people need to get it and it needs to be distributed, and that takes time. There's many other tools that we need to continue with, wearing our masks, avoiding large crowds, practicing good social distancing. But I truly believe that more of this crisis is behind us than ahead of us. And we just see that the wherewithal in this sort of final sprint here, right? If it's a marathon, we're 15 miles in, we're exhausted, but we got 9 miles left to go. And you don't want to give up now. Avoid gatherings, wear masks, wash your hands regularly, and be safe. We don't know exactly when or which vaccine it'll be. You'll hear about the different candidates, but you will hear about how the state will prioritize with a multi-stakeholder network that Diana Herrero worked with. We were able to establish our plan that we've presented to the CDC for how we will deploy that vaccine successfully in Colorado and hopefully lead the nation in building the resistancy we need to coronavirus to keep people safe and allow things to return to normal. What we do know is we won't initially get enough doses to cover the entire population, and the people of Colorado deserve to know the process of how those initial doses will be prioritized. And that's what we'll be discussing here today. Here to talk in depth about this process and the different potential vaccines is Colorado's Chief Medical Officer, Dr. Eric France. Eric?
Good afternoon, everybody, and thank you, Governor. I'd like to start today by talking about vaccines themselves. How do they do what they do? I would like you to think of the vaccine as forcing a practice session on the immune system. It's a scrimmage. It's a chance to get exposed to this virus so that the body is ready should it become attacked or come in contact with that virus itself. To give the body this sneak peek, we take a protein, one component of the virus, and present it to the immune system. And that way the immune system can get used to it, see it, understand it. For the COVID-19 disease, the protein is called the spike protein, and it sits on the surface of this virus. It's important that we build this vaccine, that we do it in a way that assures that it works and that it's safe. And the FDA has a number of rules that are in place so that when we develop a vaccine, we're following it step by step, looking very closely at its safety and how well it works. You'll see that we typically think of three phases in the development of a vaccine: phase 1, phase 2, and phase 3. The first phase involves a small number of patients, 20 to 100 at most, and it's really trying to determine what the right dosing is for the vaccine itself. How much of this spike protein vaccine is needed to get the immune system ready in its practice session. Once the first phase is done, we're ready to take it to the phase 2, in which a larger number of people are now going to be tested, looking again at the safety and the way the immune system responds to this vaccine. Common safety events might be found when you're in the phase 2 trial. This can involve hundreds of patients, but really, we're really still just looking at questions of how the immune system seems to be responding to this vaccine, this protein that has been presented to it. Finally, the real show begins, and that's the phase 3 trials. With the phase 3 trials, we're enrolling tens of thousands of people into these trials. And these are being done in communities where this disease is present. And here we're looking to see, does this vaccine actually do what it's supposed to do? Does it prevent these illnesses, and does it reduce the severity of these illnesses? And so you can see why you need many thousands of people to be involved in the phase 3 trial. The other very important information we're getting from phase 3 trials is about the safety of the vaccines. So persons enrolled are given specific cards they take home where they write down if they have redness of their arm, if they develop fever. People are followed very closely if they go on to develop symptoms. They're followed and tested for COVID vaccine, or virus, if indeed they have those symptoms. So the phase 3 trials are really the big ones that lead to the final decision to license a vaccine. Next slide, please. Now, I've talked a lot about the importance of presenting the spike protein to our immune systems. How do we do that with these new vaccines? In general, vaccines can either be the protein itself presented to the immune system, or more recently developed genetic material or genetic code for the protein, which is presented to our immune system. With the current vaccine trials underway, we're using new technologies that actually present the genetic material to our immune systems. And there are two broad categories that are being done right now. You'll see it called mRNA, which stands for messenger RNA, which is simply the genetic material that, when translated, creates a protein, the spike protein, from the COVID-19 disease. Another way of getting that genetic material into the body is to take a common cold virus, the adenovirus in this case, take out its ability through genetic engineering to replicate or grow, insert the genetic material for the spike protein, and then administer an adenovirus modified vaccine, which then enters into our immune system's cells and again produces the spike protein. These spike protein vaccines are presented to a variety of immune cells, and in that process, our immunity is built. Next slide. There are 4 large phase 3 trials now underway. 2 of them use the mRNA technologies, where the genetic material is in a protective envelope and administered in the vaccine. And 2 of them are in these adenovirus vector vaccines. Moderna and Pfizer are both in the phase 3 trials for the mRNA vaccines. Remember, too, that in phase 3 we need large numbers, so there's 30,000 volunteers in each of these 2 studies. The 2 adenoviral studies, one done by Oxford Biomedica and by Janssen, are also underway, and the number of participants range between 40 and 60,000. This has been an important time, an amazing time for vaccine science. Over the last 10 years, these new technologies of using direct genetic materials has led to an ability to quickly produce a vaccine and bring it out for use. In times past, it would have taken decades to go from phase 1 to final licensure. But the platforms that have been built, where you simply need to now put in the genetic material, is allowing us to build these new vaccines in record time. Here in Colorado, we have the opportunity to participate in vaccine trials. I know that the Lieutenant Governor's sister is one. We have other staff in our executive level group who are also participating through our local universities in these vaccine trials. We still, though, have to be patient because it will be a number of months yet before these vaccines are readily available. In the meantime, we can all do what we need to do to best protect ourselves, the people we love, the healthcare workers that we depend upon. We need to wear our masks, wash our hands, stay 6 feet apart, avoid mass gatherings, and if we're at risk for severe illness, to stay home. Thank you very much. At this point, I'm going to ask that Executive Director Jill Hunsaker-Ryan speak to us about what we're doing more at the State Health Department to prepare for the new vaccines.
Thank you, Dr. France. First, I just want to thank the people of Colorado for all the sacrifices that you're making, and you really are making a difference in helping us control this virus. Today is an exciting day. Colorado is submitting its COVID-19 vaccination plan to the Centers for Disease Control. The public should know that the experts in our immunization branch at the department and throughout the public health field, including our local public health agencies, are up to the task. Colorado's public health field has successfully distributed a new vaccine before in 2009 with the H1N1 pandemic. We worked with local public health agencies to determine where and how vaccine would be distributed within their jurisdictions. And using the existing vaccine delivery infrastructure, 1.6 million doses of H1N1 vaccine were distributed to and administered by over 1,500 providers, including hospitals, local public health departments, pharmacies, doctors' offices, and community and rural health clinics. So we've definitely been here before. Last year, we gave local public health agencies a goal of raising the statewide kindergarten measles, mumps, and rubella immunization rates from 87.4%, which was last in the nation, to above 91%. And months later, they not only accomplished this goal, but exceeded it. It was validation to us that the system is strong and that it works. Before this flu season, we asked local public health agencies to ensure that more Coloradans than ever get the flu shot in order to lessen pressure on the healthcare system with flu patients. Already, nearly 1.1 million Coloradans have been vaccinated for the flu, and it's only October 16th. This is a 72% increase from the same time last year. So I will make a direct plea. If you haven't done it yet, please get a flu vaccination. Both the governor and I have already gotten ours. Our team is used to implementing high-quality, evidence-based, and comprehensive immunization programs, communications campaigns, and program evaluations to continuously improve and enhance our efforts. The deployment of a COVID vaccine will take partners outside of the public health system. And that's why the Colorado Department of Public Health and Environment, with support from the Colorado Department of Public Safety, convened a multi-agency, multi-sector team to focus on operationalizing both receipt and local distribution of COVID-19 vaccine. We have a steering committee that provides oversight and coordination of all aspects of the Colorado COVID vaccine plan development and implementation. They serve as a conduit to executive leadership and the governor's office. We also receive advice from the governor's expert emergency epidemic response committee. Our plan covers areas of distribution and data management, and that's how the COVID-19 vaccine will be distributed and how information is managed from the time vaccines are allocated to the time they are administered. Critical populations, and that's developing phases that are right for Colorado, and determining population groups for distribution of the vaccine, since we know we won't receive all of the doses at once. We are working with the state's Emergency Operations Center and the Emergency Management Team to identify resource needs, plus distribution and redistribution plans for the vaccine. We're going to ensure that methods of distribution of the vaccine is equitable for all Coloradans. And we are here to provide public information for Coloradans to make an informed choice that's right for them. Next, I'm going to talk about our approach to distribution. This is a high-level graphic showing the anticipated COVID vaccine distribution plan. The initial supply of COVID vaccine is expected to be very limited in the beginning and will only be available in certain healthcare settings. This includes hospitals or nursing homes, and this is why it's critical that everyone continue to follow public health guidance, such as mask wearing, social distancing, and limiting small gatherings until the vaccine is widely available and used. As we move through the phases of vaccine distribution and vaccine supply increases, it will be available to more and more people and in more healthcare settings, including public health clinics and pharmacies. By the last phase, vaccines should be widely available and will eventually be incorporated into routine vaccination programs. In terms of a phased approach to distribution, using national recommendations and recommendations from the Governor's Expert Emergency Epidemic Advisory Committee as a guide, we have developed an approach to vaccine allocation that includes an increasing number of eligible individuals to match anticipated increases in vaccine availability and aligns with the implementation phases on the previous slide. We will be transparent about how these prioritizations decisions are made and are committed to the equitable distribution of safe vaccines for anyone who wants one. We have first prioritized populations most at risk for catching COVID-19, such as healthcare workers, first responders, and residents of long-term care facilities and nursing homes. The next stage will be persons living in congregate housing, essential workers who have direct interaction with the public or who are in high-density settings, and at-risk populations more broadly. And the next phase is the general population. Next, I will provide an overview of Colorado's immunization plan. Major components of the plan include how we engage a wide variety of perspectives in creating the plan, our plan preparedness exercises, how we will use the Colorado Immunization Information System Registry and other IT systems to manage data, and the many components of distribution, from enrolling providers to ordering vaccine to documenting doses that are administered. How we will communicate the right information at the right time to the right people. Our phased approach to vaccination and enumeration of the populations in each phase. How we will enroll providers and ensure they meet CDC requirements. And lastly, how we will engage our local public health agencies in our next phase of more granular planning. We want to recognize the many agencies and organizations that have formed our planning and thank them for their partnership and guidance. Lastly, I want to end with some of the stakeholders we have started to engage. We will continue stakeholder engagement even after we submitted the plan. Just know that we are preparing now, and everything we do at the state level is going to be based in science and community. We've been through a lot throughout this pandemic, and once we get a scientifically viable vaccine, it's going to be another thing that we all go through together. But I know we will get through it because we've proven ourselves resilient so far. Thank you.
You know, as Jill explained, the Colorado COVID vaccine plan represents months of work, and I want to thank Diana Herrero and many others who, pharmacies, individual stakeholders, community organizations. This plan is submitted to the CDC today. It can be amended, but it's important that as we get data about exact attributes of different vaccines and et cetera, but this is the framework that Colorado will use to prioritize and distribute the coronavirus vaccine when that is proven to be safe and effective. We really created the plan with health equity in mind, with disease containment in mind, with protecting the most vulnerable. We will continue to consult closely with many who are at risk, including our government-to-government relationship with our native tribes, officials at the Urban Indian Health Institute, communities of color, and so many others that have been disproportionately impacted by this virus. This is being submitted later today, just within the next couple hours. And just because we just once we submit it, it doesn't mean the work ends. Obviously, depending on what vaccine works and when the work really begins on the implementation, and we continue to fine-tune this as we hear from people across the state. And we're going to be flexible and adaptable. If 2020 has taught us anything, it's that the best laid plans are just that, plans. Being nimble, being flexible is of paramount importance. That might mean exercising the flexibility over your schedule and canceling that get-together you had this weekend and putting it off a few weeks with some of your friends. It might mean going out less, ordering in, cooking, whatever it is. We know we need to do better because one of the key points we want to make with all this, and I think people know, even though we might want to believe otherwise, this is not tomorrow, this is not next week. Emergency use authorization, the soonest is late November. And then even after the dosage is available, hopefully, early next year for widespread, many of them require 2 doses that are 30 days apart. So that immunity isn't even necessarily there until 45 days or so after that first dose. The first dose, then the second dose, then the immunity. So we need to have, well, again, it's a marathon. We might be at mile 15, and yes, the last 9 might be the hardest. We know that we need to pace ourselves to get this done, stay safe, save lives, and keep our economy going so people can support themselves. With that, we're happy to take some questions.
Hello, Governor. This is Vinny Dalchudas, the Bloomberg News in Denver. COVID question. What are the logistical challenges of coordinating virus response in the most rural parts of Colorado? I'm talking from vaccines to inpatient care, outpatient care, the whole gamut. Thank you very much.
I'll go to Dr. France on that. Dr. France, you want to address some of the challenges, particularly around some of the cold chain management for rural areas and all aspects of that?
Yeah, sure. Thank you for the question. Variety of challenges. It sounds like you were speaking about COVID in general as well as for the vaccine itself. Certainly, we've had a lot of experience over the last 7 months about how to build a care delivery system, urban or rural, to manage folks who are potentially ill with COVID disease. So a lot of partnering with Colorado Hospital Association, Colorado Medical Society, rural settings to help be sure that we can provide the resources, know how to move people when needed if there are care issues in the rural settings. It's true, too, that there'll be issues, and they'll vary by vaccine, about cold chain. So the vaccines themselves, I think one of them needs to be stored at a very low temperature, minus 70 degrees. It would be shipped here on liquid nitrogen. It would need to be on dry ice. It would need to be maintained on dry ice. So it will definitely be a challenge to think about how we're going to manage these vaccines in whatever form required for their cold chain management. This will be new. We've never really done something this large in the United States when it comes to vaccines, to be vaccinating 100 million people over a short time period across the states. It will be run through the local states to make the decisions about how best to approach it. I think our planning teams will be on top of it, and I have full confidence that things will go well for us here.
Let me just highlight one more thing. So built into the plan are priorities that include rural areas. So if you look at some of the outbreaks in rural areas, meat packing, congregate housing and ag, prison guards, those are all priority categories that have disproportionately impacted rural areas and will be some of the earliest to receive the vaccine.
Today, Denver's strengthened or expanded some of its public health orders, and one of the things that Bob McDonald cited was the fact that a lot of people are gathering in parks, and that being a potential transmission point. I'm wondering if you can talk about where you think the virus is spreading. I know you guys have said Denver and Adams County, but are there specific locations where, or events or things like that, where the virus is multiplying in Colorado right now?
I think we're most concerned about just social gatherings of people getting together. And while that is more dangerous inside, not the time for any kind of house parties or entertaining, very dangerous. Yes, if you are going to get together outside in a park, you need to make an extra effort to keep that distance, and you're much safer if you just go to the park with your family and enjoy yourselves in the great outdoors, and don't have a large reunion of all of your friends outdoors or indoors. To keep yourself safe, really limiting those gatherings, at most visiting with one other friend or family at a time, and not several is really critical here.
Question from Jesus from Univision. ¿Cuáles son las nuevas restricciones para controlar la propagación del coronavirus en el estado?
Estamos trabajando con los gobiernos locales para que los brotes locales no terminen impacto a todo el estado. Hay ciudades como Denver y Adams County que tienen alto número de casos que están tomando medidas más estrictas. Por ejemplo, hoy Denver anunciaron que las personas tendrán que usar tapabocas cuando están también en el aire libre, no solo entre de un edificio. Y apoyo su decisión, y necesitas más ayuda en los distritos del estado que tienen casos altos.
Hi, Governor. It's Kara Mason from the Sentinel. Public health officials have said testing is an important part of contact tracing and ultimately keeping the virus under control. Do you think that closing big testing sites like the Pepsi Center and Aurora Sports Park was a mistake now that cases are rising, and could those be resurrected?
Well, we hope so. We've always encountered our cities and our counties, and we not only encourage, we actually provide matching funds for those large-scale test sites. I want to applaud Adams County for committing to keep Waterworld open through the end of December. We deeply appreciate that. I hope that plans are underway, and I have heard that plans are underway in Aurora to launch a new testing site soon. We hope that other areas that are impacted by increasing cases do. We just made it easier to navigate where the testing sites are. We just yesterday updated our map at covid19.colorado.gov. You can click on where can I get tested. There are over 80 sites across the state, but we are very supportive of the convenience of free, quick, and easy large-scale sites, because people simply know where to go. And that's very important, especially for those who are mildly symptomatic, to just say, I know, in 20 minutes I can go to the Waterworld parking lot and get tested and find out within a day, really at most 2 days, with those tests. And we also look forward to making more of the slightly less reliable but still very important instant tests available in the coming weeks.
Hi, Governor. Mary Ann Goodland with Colorado Politics. Wanted to kind of shift gears a little bit here. I want to know what your thoughts are on a ban on firearms at demonstrations. This is a topic that's starting to sort of bubble up in light of what happened at the protest last weekend.
I'd be against that. You know, people have if they have concealed carry permits, people have the right to bear arms and protect others if and protect themselves. So I mean, I don't think that's really an issue. Nobody checks their rights at the door when they're exercising their free speech.
Hi, this is Erin Prater with the Gazette. How often might a vaccine be needed? Governor Polis, I believe you mentioned possibly one dose and 30 days later. I figure this may depend based on which one or when they're successful. Also, can herd immunity be reached with the vaccine? And if so, what % of the population would need to receive it? Thank you.
Sure. So I'm going to go to Dr. France in a moment with this. Two of the vaccines being tested require 2 doses. The other 2 are being evaluated at 1 dose and 2 dose. The other variable that we will not know because it cannot be reported out of these tests is how long that immunity lasts. That simply will not be known at this point. To discuss kind of the level needed for herd immunity, I'll turn it over to Dr. France.
Thank you, Governor. Well, herd immunity typically is actually driven by what the rate of spread is in the community, so what we call the R0, that value that describes how transmissible it is, and also by the how effective the vaccine is. Is it 50%, 60%, 70% effective? And those two combined will come up with a way of detecting what kind of level of herd immunity might be required. I think there are other things, though, that also influence herd immunity, which might be the level of wearing masks. We know that we drop the R0 down when we behave well, when we're avoiding mass gatherings, washing our hands, and living well. So the actual level of vaccination in some ways varies by our behaviors as well. So the more we can do to be behaving right, keeping that R0 level down, then combined with the actual efficacy of the vaccine, that will determine the true number of people that might need to be vaccinated. So in some scenarios, we may need to have 100% of people vaccinated. That never really happens, hitting such a high number. But maybe if you hit 50% and the R0 is managed, and you have a good, efficacious vaccine, that will be enough to actually get us where we have herd immunity.
The coronavirus crisis, at least it appears, or the trend that happens is that local governments tend to implement stricter rules and then they move to a statewide level. Denver obviously took a big step today by implementing these new rules. I'm wondering if your plan now, the cases are rising and things look to be worsening, is to let local governments kind of take the lead, see if that works, and then if not, to move to a statewide action, and what would trigger that potential action?
Thanks, Jesse. So we are seeing the rate of virus increase in different parts of areas of our state, but I want to focus on some success stories. So for instance, Boulder County had an enormous spike 3 weeks ago. They took action, both the county, the city. The increase was driven by college students, but not limited to college students. It also contained it included increases in the community, and we supported those actions. And there's been a major drop off. So Boulder County has seen a major decline in cases for the last 2 weeks. So it's a different timing of when these interventions need to occur depending on what's happening with outbreaks in different parts of the state. So right now, concern is great. Residents of Denver, residents of Adams County, residents of Arapahoe County need to be particularly cautious, particularly concerned. That might be a resident of, a different county next week or the week after, right? So it's not spiking at the same time everywhere across our state. We want to look towards empowering cities and counties and local health departments to have the tools they need to prevent deadly outbreaks and act early.
Yeah, thanks for taking my question. This is Zach Brennan from Politico. So I'm curious, is Colorado going to be creating a panel of experts to review the safety and efficacy data for any approved or authorized vaccines? And if so, are there concerns that this might be an extra layer on top of what the FDA is doing with its review? And is that going to create, further confusion or hesitancy?
No, we're going to look at what comes out of the CDC and what the science and the data shows, and implement our plan that we presented here today to successfully distribute the vaccine with the prioritization that we indicated.
Hello, this is Meg Wingeter from the Denver Post. I wanted to ask about, you talked about the initial shipment of the vaccine might actually be quite small, and you have these priority groups, but, if you get a shipment where you just can't vaccinate all of the healthcare workers and first responders, how do you then decide, okay, what do we do with what we have now?
Yeah, so this plan to the CDC prioritizes the different groups, and your question is within those groups. That's a thoughtful question that the GERC and others will look at. Diana, I know you guys have already discussed that. Do you want to discuss a little bit kind of within, say, first responders, how that can be done in sequence?
Thank you for the question. From the Governor's Expert Emergency Epidemic Response Committee, not only prioritizing within phases, but then also giving us additional guidance, even within sort of those sub-phases. If we don't have enough vaccine to vaccinate all healthcare workers at one time, we could look at healthcare workers that might have comorbidities that might put them at higher risk, and try and prioritize that way.
Hi, Governor. Mo Clark here with Colorado Newsline. My question is about the executive order you issued yesterday regarding the Special Eviction Prevention Task Force. In regards to the ban on late fees, I'm wondering how it was decided to only issue the executive order through the end of the year and not extend it through the pandemic as recommended by your task force.
What media outlet were you with?
Colorado Newsline.
Oh, okay. Here's some feedback there. We are working to implement the recommendations of the task force. Some have been implemented through executive order yesterday. The others are being stakeholder and will be implemented in the weeks ahead. I think the most important thing that we've done is we pushed more money out with the redistribution of the CARES Act money to rental assistance. We look forward to working with the legislature to help that as well. It doesn't help people when their hole gets deeper of money that they owe, late fees or no late fees. It is important that they're housed during this crisis, but of course there is a reckoning, and we need to make sure that people have the resources they need to be able to stay housed and put food on the table, and that remains our top priority. Sure.
Implement the eviction moratorium through the end of the year that was recommended by the task force?
We plan on implementing the recommendations of the task force, which was to codify the federal moratorium, clarify that, and include that clarification through executive order in the near future. Thank you.